Hello there, this is Dr. Brendan Cochran at Interactive Health Clinic. I'd like to share with you a fantastic tool that we are now using in the clinic to improve on our results with patients from a proactive or retroactive perspective. This machine right here is called the Ebu device. Ebu stands for extracorporeal blood ozonation and oxygenation. See, what's happening here is we insert some catheters, one in one arm, one in the other arm. We withdraw blood, and that blood is actually filtered through a dialyzer. This dialyzer has little spicules in it, and the spicules are known to capture certain things, beta-2 microglobulin, urea, and it's believed, possibly, based on some small studies, microplastics, biofilm, blood clots, microorganisms, and heavy metals. These are all possible findings that we're learning more about. The benefit of this that's different is just instead of filtering, these little spicules also are in contact with your blood and deliver oxygen to your blood, so you get oxygenated blood. Along with that, we can deliver ozone. And we have the ability on this machine to only give you oxygen, but we also have the ability to only deliver ozone alone. So it's very customizable, and we can personalize the treatment for you. Now, the uniqueness of this device, unlike some of the other devices, it is made in the United States. It has ozone-safe materials. There are safety studies that have been behind it, and it's very customizable in our settings that we can use. All of our providers and our nurses are certified and trained in this device, and I do also train other physicians how to safely use this device and get the best clinical outcomes. There are other devices out there. The concern that we often see is they're pressurized, they deliver too high of a dose of ozone, and they're often causing harm to patients, and that is a big concern of mine. If you ever see anybody ever holding up a collection container like this with red blood cells in them, like a frothy mess, and they say it's toxins, it simply is not. That's actually lysed red blood cells, and I'd be very concerned about getting an infusion from that specific clinic or provider. A session typically takes about an hour. We do designate a little over, almost close to 2 hours by the time you come in. We make sure to check your vitals. We make sure that your veins are comfortably warmed up and you're comfortably situated. And then we begin the process. And the whole process takes about an hour, and then you're all set to go. One of the unique things that most of our patients feel after a session is some of them are experiencing very dramatic results in their brain cognition and their overall state of energy. And this can last from days to even weeks to months with one single session. It is advised most of our patients end up getting 5 sessions. It's very, very rare that one will do it. Most people need it on an average of 5 treatment sessions. Very rarely it takes more than 5 treatment sessions. It is highly recommended, however, for proactive wellness that you do continue some level of maintenance after completing a series. This is not required, but highly recommended for optimal results. Most people find that, think of it this way. If you're using this as kind of a blood cleansing or like an oil change per se, right? And an oxygen delivery system, those are all key benefits. As we get older, we have trouble with oxygen delivery, oxygen utilization, and something called nitric oxide, which is important in dilating our blood vessels or protecting ourselves from things like heart attacks and strokes. All of these things are greatly benefited by using this machine. So if you want more information or to learn more about how you can utilize this in your condition and if it will benefit you, please give us a call at 425-361-7945 or visit our website at Interactive Health Clinic. We look forward to serving you and adding a new piece of treatment to get you results.